Welcome back to The Morning Blind. Getting a cancer diagnosis is scary, but imagine for a moment that you weren't able to fully understand your doctor.
The Aurora Cancer Care Spanish Clinic not only provides exceptional care, but they meet the language and cultural needs of their patients and families. And joining us now is the head of the clinic. It's Dr. Federico Sanchez. Good morning to you, doctor.
Good morning, ladies. It's a pleasure to be here.
Yeah.
Nice to see you.
That thought, I think, is awful, to think that not only are you getting this devastating news, but you're not understanding half of what's being said. How common is that?
Very common, and in fact, it's not a language issue. It's the fear that derives from the word itself.
Yes.
I tell my patients that the most feared word is not four-lettered, it's six. And once I have a patient, I tell them they got cancer, their eyes gloss over, their vision goes up and say, I'm dying, and they stop hearing.
Can't hear anything.
Even if it's the earliest stage. That's one of my biggest pet peeves. It'll sound funny and it'll be an anathema when I say it here on TV. That's why I don't like breast cancer.
Yeah.
Because as a physician, breast cancer is very curable, but it's so scary that it's developed a culture of its own that I think it's detracting from the rest of the diseases, because then we're losing the focal point of the process.
Yeah.
Because cancer is one illness with many variations. If we focus only on one, we lose track. Having said that, I think they've done a lot with the support programs they have for breast cancer and everything else, so I'm not going to say anything bad. I mean, I'm just saying that's one of the defects that we have.
Well, and to know that a doctor feels it's so curable, I think is something that is so refreshing and great to hear for so many people, is that, you know, there is hope for so much of this, but the fact that people stop, hearing, and especially if there is a language barrier, that's part of the reason Aurora created this cancer care Spanish clinic, right?
Correct, because it provides two things that we can look at. One, it provides adequate communication. Why is adequate communication so important? Because the interpretation program that we have in a lot of schools is very helpful and it's necessary. But they filter things, and not on purpose. But you imagine somebody who's been trained just to translate, and all of a sudden they're thrust into the middle of a situation where we're talking, well, you have an illness, if you're not treated, you can die in 6 months. How emotionally will they handle that on their own?
Yeah.
Some people can, some people can't. And I've been caught, because I can speak very fluent Spanish and English because I'm a native speaker of Spanish, but I can mumble some other languages and I can muddle my way around, and I hear the translations. They're not that 100% accurate.
Right.
So that sort of pushed us to try to create something, because the Hispanics are 30% of our population now, and to be able to provide the information they need.
Directly.
The other important thing is research in medicine has developed a name which is good, but you have to know it comes from dark origins, because we all have the human research that has been described as being unethical and illegal, and the news has been full of it since World War II. I mean, without going too far, polio virus and the polio vaccines were experimented on prisoners in northern and upstate New York. The use of penicillin for STDs was done in Alabama and in Central America. So there are very strict rules when it comes to be able to enroll people in research. Research is becoming important. Our Hispanic population is big, and to get them into our research programs, we really need them to speak Spanish.
And understand.
So we've created, to use a buzzword, a virtual clinic. We don't have it physical, it's very fluid that way, in which we have myself that speaks fluid Spanish. I have a nurse practitioner that's fluid in Spanish, pharmacists that are fluent in Spanish, and also schedulers. So we help the patient from the beginning to the end, and we have consents for research in Spanish, everything in Spanish, so patients can actually participate in the progress of medicine, which is quite extensive and quick and fast-paced, to the point that even us old-timer doctors, because I'm getting old, can't keep up with the data.
So that's obviously something that makes the center very unique. What are you hoping that the experience is like for patients?
Well, we want them to feel comfortable. That's the most important thing. We want them to feel that they're not being cheated over the experience, that they are getting everything possible that can be given to them, and they're getting the utmost care, and we're providing the best quality medicine we can. Quality medicine doesn't mean you have to use the most expensive, newest drugs. Sometimes the goodies but oldies work just as well. But we have a lot of people say, if I'm not getting the most expensive, I'm not being treated. No, you have to understand the whole process.
What kind of cancers do you treat, and also what kind of services do you offer then as part of the clinic?
Well, this clinic is because it's St. Luke's Hospital. We're located, and we can provide the information, but it's St. Luke's Hospital Cancer Care Program. And there we see all cancers, all types. We're actually big enough that we're subspecialized. We have a doctor that does everything. My area of expertise is gastrointestinal cancers. I got melanoma cancers, breast cancers, paid doctors, all of them, and they're divided in multidisciplinary meetings. So we have a team of people intervening. And so the Spanish clinic is following the same process.
I like that. A team, I think, is very important.
Yeah, I think so too. And if someone wants to visit your clinic specifically, is there anything they need to do? Is it only by referral, for example?
No, they can just call the Aurora Cancer Clinic and ask for an appointment, and it gets scheduled in. Sometimes it will be me, sometimes it may be one of my other colleagues, whatever the specialty needs, with my nurse practitioners and dedicated translators.
That's wonderful. Here's the information so you can give a call and get some care that fits you. To learn more, call 414-384-5111. You can also access a Spanish voicemail box at 414-389-4619 too. That's the Aurora Cancer Care Spanish Clinic for more information. Thanks for being here, Doctor.
Great to meet you.
Oh, it's my pleasure.
Really
Thank
appreciate
you.
it. Gracias.
You're welcome. De nada.